Hello, my name is Scalercio. Today I'm going to be doing a Module 15 video presentation assignment. Here is my flashcard with the points that I'm going to be covering. Okay. So the external structures that can be observed on the body. This is my wife, who's going to be my model, and I'm going to be pointing out the upper body structures because of the camera angle. So first off, let's start off with the jugular notch. The jugular notch is right here. It's formed by the superior surface of the manubrium and the sternal ends of the clavicles. The next structure is the head of the humerus. If we externally and internally rotate the arm, I can palpate and see to a degree the head of the humerus rotating in the glenoid fossa of the scapula. Next, let's look at the elbow joint. This bony protuberance right here is called the olecranon process. Move to the anterior surface of the arm. I can palpate and see the biceps brachii muscle. Move down to the lower arm at the wrist joint. Here is the radial styloid process. 4 of the external structures that I mentioned are part of the skeletal system. The jugular notch formation, the head of the humerus, the olecranon process, and the radial styloid process are all part of the skeletal system. The biceps brachii belongs to the muscular system. Surface anatomy is very important to know and understand for anyone who's going into a medical or scientific fields. Surface anatomy helps us to see what is unseen beneath the skin. You can see and feel bony landmarks, muscles, tendons, veins, and cartilage just by observing the external structures of the human body. This knowledge can help clinicians and scientists alike with diagnosing and recording individual patients' anatomical makeup. So being a therapist in a rehab hospital, I see many anatomical oddities. I've seen patients without limbs, broken bones, tracheotomies are all really common. 2 of the structures that I mentioned, and their importance to my field, could be the head of the humerus. I see shoulder subluxations often as well, and can tell how the head of the humerus usually anteriorly subluxes out of joint. It's important to notice these occurrences and to guard that shoulder and protect the integrity of it during functional activities with patients. Another application could be the trachs that some patients come in with that sit right there above the jugular notch. Okay, that concludes my video. Thank you very much.